You remember earlier in the week that whole Bakersfield nursing home thing?
Yes.
There was that 911 call.
It's disturbing, I'm going to be honest. When I heard it, it's disturbing to listen to. Anybody who has a grandparent that's in a home right now can, I think, relate to this.
So there's this 911 call, and this woman collapses, and the dispatcher on the other end of the phone is going, "Come on, we got to try and do CPR." Here, listen. I'm sure you've heard it by now, but take a listen.
We need to get CPR started. That's not enough. Okay.
Yeah, we can't do CPR.
Okay, then hand the phone to the passerby. If you can't do it, I need to hand it to the passerby. I'll have her do it. Or if you've got any citizens there, I'll have them.
No.
All right. So the home, according to the original reports, were that they had a policy that their on-site nurses and staff don't do CPR, and many of us are thinking to ourselves, "What the heck? I mean, why would you not try and resuscitate this woman?" But apparently, there are a lot of people that think that was the right move for a variety of reasons. Here to have that discussion is Dr. Lynette Cederquist, who is an internal medicine doctor at UCSD. Good morning, doctor. How are you? Thanks for being here.
Sure.
So I'm just curious. I mean, medical community, an opinion on here's a nurse. She's a medical professional. There's a person dying in front of her. She knows what to do. Should she have done anything?
Well, I think you have to think about what these facilities are set up to do and what the outcome would be if they had tried to resuscitate her. Most of these independent living senior facilities aren't really considered a medical facility per se, as a residential. So they're not really obligated to provide more than basic medical care. And the reality of the success of trying to resuscitate somebody in a chronic care facility is that virtually none of them survive an attempt to resuscitate them. So medically, it really probably doesn't make sense to try to resuscitate somebody in this setting because your chances of success are virtually zero. So whether she was thinking about that when she spoke with the 911 operator is hard to say, but medically that probably was the best decision, even though on the tape it sounds cold.
Yeah, it does. It sounds like she's not even going to attempt it whatsoever. It's like, no, I can't, sorry.
Right, and the dispatcher has this tone like, are you crazy? This woman is dying in front of you. You're a nurse. Help her. And if you can't or won't,
give
get
it to
somebody.
Someone and I'll walk them through the steps.
Why though, doctor, do you say that the chances to resuscitate an older person living in a home like that are virtually zero? Why is that?
Because that's the reality of the statistics of when they have attempted to resuscitate people in that setting. And it's probably a combination between these facilities are not set up to administer advanced cardiac life support, which is what you really need to successfully resuscitate somebody in most instances. And these residents, because they're living there, are by definition frail and elderly, and most of them have deteriorating health, so their chances of successfully coming back from their heart stopping, even in the best of circumstances, is virtually zero.
At first when I heard this, I was disturbed by it, and I thought, gosh, I can't believe, like, you think of your grandparents and think, but at the same time, I heard what the family said, and they were like, no, it's not a problem, we're not mad, we understand what we were getting into when we put her in the home. And so once you kind of hear that, there's a little bit more understanding. It's kind of like, okay,
yeah,
what was done was done.